in zone 4-5, just above the pad of the heel. Then from the ileocecal valve, you're going to work up the ascending colon reflex, so that will just be straight up in zone 4-5 to waist level. So use the right hand to work up that area. And then at waist level, change hands and work across for the reflex to the transverse colon. Then the reflex for the bladder, for the ureter tube and kidney and adrenal gland. So the bladder reflex is found on the inner border of the foot. There's sometimes a slight puffiness on the side of the foot, quite close to the lumbar spine reflex. So get the fingers just underneath the back of the heel so that you can get the thumb on the reflex point on the side of the foot. Then work slightly underneath the foot as well. And then work upwards and outwards to zone 2, zone 3 at waist level. So you would have worked up the ureter tube reflex to the reflex to the kidney at waist level. Just on top of the kidney reflex, you will find the reflex to the adrenal gland, which will be slightly higher than the kidney reflex and slightly more towards zone 1, but still in zone 2. Then the reflex for the sciatic nerve. That you're going to find a third of the way down the pad of the heel. So in this rather tough bit on the sole. It doesn't matter whether you work from right to left or from left to right. So work that area across the pad of the heel for the sciatic loop. And having worked that one precise area, it's sensible really to give massage to the whole of the pad of the heel, which will relate to the pelvic areas. It's a very insensitive part of the foot, so it's unusual to find any tenderness in that area. Then continue the reflex of the sciatic nerve up the side and up the back of the leg. So using the third finger on either side of the foot from where you've traced across the sciatic loop reflex, works across the side of the foot to the back of the heel, and then work up the back of the leg for about 3 or 4 inches on either side of the Achilles tendon. Then use a pinching action to come down the back of the leg. Don't raise the leg too high, but just get the hand cupped underneath the back of the heel and then just pinch gently on either side of the Achilles tendon. Then on to the outer border of the foot. Firstly, the reflex to the sacroiliac joint, which you find in the small dip just in front of the outer ankle bone, about in line with the 4th toe. Then the area below the outer ankle bone, which relates to the muscles of the pelvis. So use the thumb to work that area, just arching round beneath the outer ankle bone. Massage that area a couple of times. Then the reflexes and the hip. And these you find between the bony projection on the outer side of the foot and the very back of the heel. And they're present in 2 large half-moon shapes in that area. First half-moon shape relates to the knee, second half-moon shape relates to the hip. And what you want to do is to just fill in those half-moon shapes with your massage. So use the thumb working from the base of the foot, just working upwards slightly. It's quite difficult to find those reflexes sometimes, so you need to work quite precisely on the areas. Then the reflexes to the reproductive areas. The reflex to the ovary you find on the outside of the foot halfway between the tip of the ankle bone and the very back of the heel. Measure up that area. I find most people look for the reflex too far forward. It's much further back than people think. And finger pressure is sufficient on that area. The reflex to the uterus is found in exactly the same position but on the inside of the foot, halfway between ankle bone and the back of the heel. And then joining the two over the top of the foot is the reflex to the fallopian tube. So work from the ovary reflex using the thumb and coming up over the fallopian tube reflex, which is just in front of the ankle bones, round to the other side. And the lymphatic reflexes on the top of the foot. So you're going to work down from the root to the toes to above the ankle bones. Finger pressure is probably easier on the top of the foot because of the angle that one's sitting. So just massage gently down from between the root to the toes, right the way down the top of the foot until you've gone over the top of the ankle bones. And you might use one finger like that, or you might use 2 or 3 fingers together as you work down the top of the foot. Don't work too heavily on the top of the foot because there are a lot of little blood vessels near the skin surface which can easily be bruised if you press too heavily. If you wished, you could use the thumb to give that massage. As I say, really depends on what height you're sitting as a practitioner. It's slightly more comfortable to use the fingers on the top of the foot. Having done all the area on the top of the foot, and you will have overlapped the breast reflex just above waist level in zones 2, 3 and 4, you then need to work the reflexes to the lymph nodes of the pelvis and the groin. Use the fingers just to massage around the ankle bones on both sides of the feet and go around a couple of times. And then a pinching action between the big toe and the second toe is equivalent to the lymph drainage point. And it's really only necessary to pinch between big toe and second toe. I know some people like to do all the toes. Doesn't really matter. So then you've finished the points on that foot. We'll just do the exercises to that foot so that you see them on each. So firstly, the toe rotation. The big toe joint is the one that needs the most support. So put the right hand around the right big toe joint and then just rotate the toe around. Then using the hands in the same position, you can probably rotate all the toes around. If you've got quite big hands and it's quite a small foot, you might need to change the hands round for the 4th and 5th toes. Then the ringing action on the foot. So the top hand goes around the little toe, so fingers on the top, thumb underneath. The other hand is similarly placed beneath the foot. Just ring the hands apart as if you're spreading out the bones of the feet. Then the kneading action. Using the flat surface of a clenched fist, press up at diaphragm level on the sole of the foot, put the other hand flat on top of the foot and press those hands against each other, rotating at the same time. Then rotation of the ankle. So just pop one hand under the heel just to raise the foot very slightly and just ease the foot round in both directions. Make sure that it's you, the practitioner, moving the foot round, not the patient moving their foot round. And then that foot's finished. So it's onto the left foot. So start with the pituitary reflex in the centre of the big toe. So use just to straighten the toe out slightly, holding it at the tip of the toe, and massage in on the pituitary reflex in the centre. Then also work a little bit around that area. Sometimes the pituitary reflex may be a little bit higher, a little bit lower, a little bit more to one side. And by also working around the pituitary area, it will be working on reflexes to the other parts of the brain. Then the neck reflex at the base of the big toe. So start on the inner border of the foot and work across where the toe joins the foot. And you can move across just the once or maybe a second time. And then up the side of the big toe, next to the second toe, for the reflex to the side of the head. Then change hands and work over the top of the big toe for the reflex to the top of the head and the top of the brain. Follow the spine reflex down the inner border of the foot, working with the right thumb, starting with the cervical spine, working down through into the thoracic region, and then into the lumbar region, and then finishing off with the sacrum and the coccyx. So the coccyx reflex about half an inch in front of the back of the heel. Then change hands and work back up. Slip the hands and fingers underneath the heel so that you can work the lower part of the spine reflex. And then you can bring the hand round onto the top of the foot. As you apply the pressure, to avoid sticking your nail in the foot, make sure that you ease your nail back slightly against your own flesh. Otherwise, even with the shortest of nails, you will stick your fingernail into the foot. Then, having worked the spine reflex, let's massage the top of the upper aspect of the big toe for the reflex to the face. So finger pressure is quite sufficient to cover that area beneath the nail, and work from the base upwards. Then the sinus reflexes in the small toes. So you've got to work each toe in turn, working from the base up to the tip of the toe, and support each toe from the tip, so just straighten out each toe in turn. And in some instances that really is quite necessary. These are fairly straight toes, but some people do have very curled toes. And remember, as we said with the other foot, that if you really can't get in between the toes, working in a forward direction as is preferable, then it is permissible to work in a backward direction, working from the tip of the toe. And so you could do that way. So each of the toes in turn. And then also the fronts of the toes for the teeth, so work from the base up to the tip. Finger pressure sufficient. No need to work over the nail. Doesn't really relate to any specific part. Then the eye reflex. So pull the second and third toes back and work just below where those toes join the foot. So using the left hand, work across, and then the reflex to the eustachian tube just below the web between third and fourth toes, and then the ear reflex beneath fourth and fifth toes. So again, pull those toes back so you can get nicely in beneath the join. Then the shoulder reflex. So that's going to be found just beneath the fifth toe, on the side of the foot, and on the top of the foot. So work the part on the sole of the foot first, and then work down the side of the foot, working down to the bony projection on the side of the foot. So from the shoulder reflex you then have the arm reflex,